So you do a lot of blood tests, is it, in
A
Ayurveda?
lot. I mean, it's not like Ayurveda talks about it. When Ayurveda was there, we had a lot of understanding about pulse, urine, and the poop, how these things are there. But now today, we are using as many modern investigations to correlate and see what's the best way
You
to move
also do
forward.
allergy testing.
A lot of allergy testing.
Oh,
But allergy testing only gives you what you're allergic to.
true.
But the more important question that we need to ask is, why are you allergic to that? And
Mm.
then why am I just allergic to lactose? See, if I'm allergic to something, what the body is trying to tell you is, somewhere I got overburdened with that one substance, and now my body is not able to identify if that is a real healthy stuff or something that's going to trigger me.
Mm.
So somewhere my innate intelligence has lost its ability to discriminate what is a true poison and what is not.
Mm.
If you look at
I get it.
allergy, it's like
Mm.
something that is not necessarily toxic, but the body is responding to it as it's something toxic in nature.
Mm.
So the body's innate intelligence.
Correct.
So that innate intelligence comes. That is why when people follow that circadian rhythm, that routine, I've seen patients allergies reversed not because of my prescription, because they quit their job.
Mental peace.
Mental peace.
Yeah.
I've seen patients, they leave their home from their parents and they go out and they suddenly all their problems are gone. And the vice versa also.
Yeah.
They're lonely in some North American country, which is, and then they come back to their home and they're with their parents and their home food, their problems are gone. So of course the surroundings, uh, when during the pollen months like the April, May, especially in Europe, they have this pollen allergies. In these times, what we tell them, maybe that's a good time to do panchakarma. It's like a seasonal cleanse that we tell. We have this concept called Ritucharya. Ritu means the seasons, and Charya means like I know that if it's going to be raining, I have to carry an umbrella so that I'm prepared for it. So I know the next 2 months, like in Europe and many cold countries, before the winter comes, they have to put winter tires. It's just a preparation. Same way, when I know the pollen time is coming, and the winter time my body's mechanism is different and suddenly the sun is going to come out a lot, that's a good time to bring down the excess mucus load in your body. And usually when I say, especially patients who have this extreme cold winter and then they go to this pollen climate, they have this hives, they have this pollen allergy, sometimes it can lead to near death experiences because of this allergic reaction. So at that point of time, I tell them to do a panchakarma in the months of February and March, so that the April, May, they feel suddenly when they get exposed to this pollen, maybe it handles it better, because what used to trigger you, you're much better prepared. So that ability to overreact becomes a much better resilient response. So that's why, to bring down the excess mucus load, maybe at those times I sleep better, I avoid alcohol, I avoid heavy pastries at night, or if you're eating a lot of croissants or a lot of pastry food and heavy in sugar and fat, these are the things that is called sticky in nature. Not just sugar, but sugar is a basic currency, yes. So that is pitchila and heavy in the body. So I tell them to reduce that, and doing a panchakarma just prior to that, it has a huge impact. So coming to that, correcting the food concept, correcting your sleep hygiene, improving your emotional resilience, working on that. And if certain things are beyond your scope of control, sometimes I tell them, sorry, you have to change your location. Living here, experience taught me medicines are not going to help you. Changing your location is the only way, or changing your job is the only way. Because all these prescription, it might give you a symptomatic relief or a placebo effect, but you're going to keep going back to square one again. So, and this disease is coming and telling you, now is the time. I'm coming and reminding you, please change this.
Yeah, like my daughter, no matter how many medicines we give, she's an atopic child. She sneezed all away when she was young. She used to have those hyperreactive lung, and now she keeps getting allergy every now and then. She's studying in London now. She's perfect there, like perfect. We used to think, oh, is it fruit from the fridge? Is it curd? Is it this? Is it that? We tried to make her cut down everything, but there she goes, eats all of those, and she's still fine. So it's just the change of place, probably change of humidity, change of the pollens, change of the dust. She's just fine there.
Yeah, I've seen patients with psoriasis, they are much better in humid climate. And extreme dry climate, it just the flakes. And I see patients with psoriasis from Delhi because they have the extreme dry weather. How to know if it's a dry weather? You always need a lip balm. So people with very dry skin and flaky skin, dandruff, high mucus, dry weather places does a havoc to them. So they have to do real protection for them, doing panchakarma, doing oil application on the skin, and having a healthy skin regimen. You protect yourself. And if the situation gets worse, you need to use a dermatological steroids so that it will give you a symptomatic. So you need this hybrid model. That's how, I collaborate with a lot of allopathic doctors. This helps. And see, me as an Ayurveda doctor, I'm not married to the idea that only people should take Ayurveda. It is what is best for the patient.
So I think today, especially in today's age, it's only the collaborative medicine that helps. It's the overall wellness and overall, like you said, longevity is there anyway. It's not that we're
Yes.
contributing to longevity, but a better health during longevity, vitality during longevity will only come with the intelligence of a collective medical sphere,
Exactly.
like right from the way you live, the way you eat, the way you think. So to me, it's even in English medicine, I keep saying I need a very good psychologist to assist me while I'm even treating an acne patient.
Oh my God, acne patients have the severest anxiety that I can tell you.
I need an help of a counselor. I mean, we do, like you said, in a consultation, we do a little bit, but that's only little bit, and we're not experts in that. So you do take in help wherever it is required in any skin disease. I've seen overall in dermatology, mind plays such a big importance, and there is so much anxiety because that's something which is seen, right? As against, yeah, if your gut is wrong, it's hidden inside, only you know it that it is wrong. But if skin is wrong, the world also knows it that it is wrong. So it's so much of anxiety associated with it, and because of anxiety it becomes worse.
It's like BP patients.
Yeah, it's for me, I need a psychologist, a counselor who will work with me in tandem. Likewise, we may need a gut expert in many situations. We may need a nutritionist in many things. This whole skin science as a podcast was conceptualized for that, so that I can tell people, I can impress upon everyone that dermatology is not just dermatologists. A skin belongs to everyone, so I'm going to bring everybody's perspective. So overall, it will help our audience lead a better life. Likewise, different specialities. So I take away sometimes from a Bach flower remedy, from Ayurveda a lot, like I said, because that's something that we've kind of grown up with, from natural home remedies. So I'm very inclusive. I love including all of this into the skin.